Good morning. Welcome back to denwalker.com. I want to talk a little about cholesterol this morning. Someone came to me yesterday and she said, "What do I need to do naturally to reduce my cholesterol?" And I was overall befuddled by the whole question because I thought, what part of cholesterol are we talking about lowering, right? There are so many parts of cholesterol. And I reminded her that, much of your brain and your tissues and your belly and your skin and your estrogen, your testosterone, all of those things require some element of cholesterol. Again, the brain, the spinal cord, the nerve roots, right? All require some degree of cholesterol. So when you say, how do I lower my cholesterol? It's like, how do I lower my saliva? I don't know what we're talking about. So I thought I'd put some words out there regarding what I think she's asking, and then go from there. So the first thing, I think, when people say cholesterol, they're thinking two things. One, the total cholesterol, or two, the LDL cholesterol. And I think I talked about this before. So the LDL cholesterol, I think, is in play because we have a drug that, quote, lowers the cholesterol, specifically statins. Statins can lower your LDL cholesterol. Some people say 20%, some say 30%. But again, remember that the LDL cholesterol is made up of several subunits, right? And not all of them are determined to be, quote, bad. And in fact, it depends on who you read or what you read. Even the part of the cholesterol that is supposed to be damning, the small, dense particle segments, even those have a role to play, and decreasing them could be disadvantageous to our system, again, because cholesterol is utilized to making so many things. And now, the thing I like about the part of cholesterol that people are demonizing, the small dense, one thought is that when your blood sugars are chronically elevated, your insulin levels are chronically elevated, that then can cause some degree of inflammation within the lining of the blood vessel, specifically the endothelium. And then the small dense particles, they're almost like the fire truck, if you would, that comes to an area where there's inflammation, or there's a building burning down, for example. They come to the area and their intent is to put out that fire, right? So the fire trucks come to the place that there is burning happening, there's a fire happening in the building, and their intent is to put out that fire. Sort of the same process with LDL cholesterol. LDL cholesterol comes in the area that you have inflammation, and that inflammation typically is caused by elevated insulin, elevated sugars, blood sugars, and it's really there just to put out the fire that is caused by what we are eating, right? And so when we take a medication that, quote, lowers that, we are lowering the response to the fire trucks coming to the building that's burning down. Same thing with this. When you decrease the small dense cholesterol particles, you're technically just decreasing the response to the inflammation that we are causing by the types of foods that we eat. So do you really want to do that? Do you really want to decrease the response to the fire trucks coming to the area where there is damage, right? Do you really want to decrease the LDL cholesterol? So the large buoyant part, which is the other part of the LDL cholesterol, is the part that most people understand is not or does not cause a problem. So in other words, there is no known associated damage caused by the large buoyant particle. So again, the only part they're talking about that's really bad is, quote, is the small dense particle. So that's my take on it. That's the take I now understand it to be. So a statin, from that degree, is decreasing the amount of fire trucks, or the response of a fire truck to the actual fire, right? That's my take on it. So the other part, which I think people should really pay more attention to, specifically the triglycerides, that is really the thing that's going to cause you the most amount of problem. And it's not discussed a whole lot by the medical community, because there are a few drugs out there that can decrease your triglycerides, but they're not as popular as right? The other ones that we make a lot of our money from. So the triglycerides has a high mortality risk for you than the LDL cholesterol. It does. That is the thing that we should control, and that is really a reflection of chronic elevated blood sugars. That's really what that is, right? It's if your blood sugars are elevated chronically, then your triglycerides are going to be elevated chronically. So what you really want to control is that thing. You want to control your triglycerides to be certain that they are in accord with what they should be. Now, one way of looking at it is to look at the triglyceride HDL ratio. So when you get your cholesterol panel, look at the triglycerides, and let's just say that it's 200. Then look at your HDL cholesterol, and let's say that is 100. Now, that's a 2-to-1 ratio. What you really want to do is get that ratio, that triglyceride HDL ratio, down to about a 1, right? So ideally, you want your triglycerides to be 100 and your HDL to be 100. Ideally. Now, here is what I would suggest. If you're going to then target your, quote, cholesterol, target the triglycerides. And how do you reduce the triglycerides? Pretty straightforward and pretty simple. Any of those processed foods, the white foods, the flour, the sugar, the bread, the pastas, those will increase your triglycerides. Any of the sweetened beverages, my daughter would say beverage, right? Reduce those as much as you can. Reduce the sodas, the fruit juices, they have the fruit punch thing, or they have the orange drink, or they have the pineapple drink, right? All of those things are just loaded with high fructose corn syrup, and those things are going to increase your triglycerides. Cakes, cookies, pies, again, processed foods, those will increase your triglycerides. So target your triglycerides and ways to reduce it. And I'll put some of that in the body of this, in the comment section. Target those things, and as you reduce those foods, the processed foods and cookies, cakes, pies, and drinks, and orange drinks, and orange and candies, and all those things, as you reduce those, you will see that your the ratio is going to normalize more to that 1-to-1 ratio. Now, there are a few people out there that have familial type of hypertriglyceridemia. So in other words, you have elevated triglycerides, and it's sort of a familial thing they're talking about. For those people, and really for anyone, you need to then increase things like your omega-3 fatty acids. So more salmon and wild caught, obviously, salmon and cod and mackerel and herring, right? All of those things, increase those things. Add more things like fish oil to your diet, or krill oil to your diet, right? All of those omega-3 fatty acids, increase those. Fish oil, increase those. And any kind of food you can add to your list, not chia seeds, add those things to your list to increase the omega-3 fatty acids. And you may want to, and you can look at some comments. You want to maximize those omega-3s, right? You want to maximize your fish oil content daily, just to get that number to be more normalized. Now, it may be more challenging for some of those folks with the familial type of triglycerides, but it can be reduced, and it can come onto a more normalized level. And again, target that goal to be 1-to-1 triglycerides HDL ratio. Now, Dr. Walker finally is not telling you to stop your statins, right? He's not telling you that, but have a conversation with your doc about the need for that, right? And the conversation is changing every day in terms of what statins will do for you. The absolute reduction risk for adding a statin, I do not see it. I don't see it. But talk with your doc about ways of reducing or eliminating statins altogether, and go from there. Anyway, thanks for listening. Dr. Walker, have a blessed day.